Hello, welcome to Dr. Sunny's Med Today we are going to start with esophagus and in esophagus, the condition we are going to start with GERD. GERD is a gastroesophageal reflux disease or condition which develops when the reflux of gastric content causes troublesome symptoms or complications. The most common etiology here is inappropriate transient relaxations of LES. Here, the clinical features are heartburn, which is the most common. Heartburn is a specific condition, GERD, which followed by regurgitation, and regurgitation and heartburn is being seen in 80% of the patients with GERD. There are probably two types of symptoms. First is non-esophageal symptoms and then is esophageal. In non-esophageal, we have other subtypes, respiratory as well as non-respiratory. So in respiratory symptoms, we have chronic cough, as well as there are wheezing and aspiration pneumonia. And in non-respiratory, there is sore throat, hoarseness, and dental erosions. The most is enamel. So there is restriction of enamel in this condition. And esophageal, there are typical esophageal symptoms such as heartburn and acid regurgitation, as and atypical, we can say in atypical, it is chest pain, atypical, chest pain, dysphagia, and odynophagia. Odynophagia is a rare condition, and dysphagia is a late symptom. The factors that helps to maintain latency in LES is length of intra-abdominal esophagus, angle of His. Now, what is the angle of His? Which is this is the esophagus and this is the stomach. So this is the fundus part of the stomach. So the angle created by esophagus and the fundus is called as angle of His, which maintains the latency in lower esophageal sphincter, as well as there is a pinching or piercing effect of right diaphragmatic curve. This is right diaphragm, which pierces as T10, which also helps to maintain latency in LES, and arrangement of gastromucosal folds, which are the longitudinal folds that helps in maintaining the latency. Factors that predisposes the GERD. Predisposing factors are length of intra-abdominal esophagus less than 2 cm, pressure less than 6 mm of Hg, as well as increased number of transient lower esophageal sphincter relaxations. How? Investigations. So, investigation of choice is upper endoscopy endoscopy or upper GI endoscopy, and gold standard is 24 hours pH monitoring. So, what's the difference between IOC and gold standard? Now, IOC means investigation of choice, in which it is the simplest method for investigation, and which is been done in less time and gives us proper diagnosis. But for the most proper diagnosis, gold standard is being performed. So for most proper diagnostic, gold standard is being performed. But the problem is it takes much time, much more time. So it's time consuming and it requires 24 hours. So you are not going for patient to monitor 24 hours the pH. So yeah, investigation choice is always upper GI endoscopy. Now in the management, the most Required management in this condition is lifestyle changes. Now, lifestyle changes includes proper food. Proper food means stop eating spicy food, fatty food, tobacco, as well as citrus food or citrus fruits such as lemon, oranges, etc. Here also stop smoking and alcohol. The lifestyle changes also, the other thing which include is have a dinner before 2 hours of sleeping. Lifestyle changes does not cure, but helps to decrease symptoms. PPIs are treatment of choice here. It is the most effective therapy, and it should be continued as a maintenance therapy. On demand, you can add antacids or H2 blockers for this condition. That helps symptoms, not the disease. So PPIs along with lifestyle changes is more important in this condition. Now, surgery is also being performed in the patients who are not responding to medical conditions for this treatment, as well as patients suffering from complications of GERD. We'll see the complications later, as well as associated with sliding hetal hernia. Many of the patients are on PPIs for longer period of time, but GERD does not resolve. So PPIs may cause adenocarcinoma. So to avoid adenocarcinoma, patient should be to undergo surgery. Now, the name of surgery or type of surgery here we do is fundoplication. And fundoplication, it is the wrap of upper stomach. So wrap is been created by the surgery, which increases the LES and helps to cure GERD. Two types of fundoplication has been done: complete fundoplication and partial fundoplication. Complete fundoplication and partial fundoplication, they both are different, and for longer period of time, for creating more pressure and LES uh, is done by complete fundoplication, but complete fundoplication has some problems through it. Here, this is the complete fundoplication, and complete fundoplication which causes formation of gas in stomach, and it causes, due to complete fundoplication, absent belching syndrome or no belching syndrome. So person cannot belch, and which causes frequent flatulence. So this is the problem of total fundoplication or complete fundoplication, which is also called nascent fundoplication. But there is no problem within partial fundoplication. Before going to complications, we will see some side effects of long term of use of PPS, proton pump inhibitors. Some may cause C. difficile diarrhea, hypomagnesemia, and vitamin B12 deficiency, as well as stopping of PPS can increase gastric acid above baseline by a rebound effect, causing heartburn even in healthy volunteers. So these are the side effects of PPS. Now we'll go for complications. Complications of this disease is esophageal strictures and which can cause dysphagia. And this dysphagia are more for solids than liquids, but causes dysphagia for both solids and liquids. The second is esophagitis. These are the complications of the GERD. The third one is ulcers. Fourth is bleeding. And fifth, the most common is Barrett's esophagus. So, this is the complication of Barrett's esophagus. Now, we'll see Barrett's esophagus. What is Barrett's esophagus? It is a metaplasia of normal squamous esophageal epithelium to intestinal collar epithelium. So, it is from stratified squamous to non-ciliated columnar epithelium. This is most probably caused by long-standing GERD due to damage of squamous epithelium. Barrett's esophagus is most common in North American continent or in developed nation or in Western countries. And here, almost with GERD, 20% have Barrett's esophagus. So, treatment here will give high dose of PPS for indefinite period and carry out upper GI endoscopy for or in between 2 to 3 months. One also in part of China, supplementation of selenium, and vitamin E helps in reduction of GERD. So this was of GERD. Thank you for attending.